Good day, ladies and gentlemen. This is Fruhan Landman from Key Wealth, and today we're going to have a quick overview of the Beat 1 option for the medical scheme Bestmed, and this will be the benefit summary for 2022. I'm only going to run through the most important parts of this and some of the changes. And at this stage, you can just pause to have a look at the premiums for next year. I think these premiums are absolutely incredible. For the non-network option, in other words, any hospital, it's 1,746 Rand for a principal member. And if you elect to go to a network hospital, it's only 1,570 Rand. Definitely one of the cheapest hospital plans on the market. And then for the children, it is a lower premium of 734 Rand, which is also not bad. So important with these options is that if you opt for the network portion, the network hospital, you must make sure that you've got a hospital in your district or close to you. And if you go to the wrong hospital at that stage, you will have a co-payment of 12,373 Rand. Please reach out to us if you choose the network option so that we can add a gap cover for you. A gap cover can cover a large portion of that co-payment should you need it. So the Beat 1 is essentially in-hospital cover only. It doesn't provide many benefits out of hospital, and it is what we call 100% option. In other words, the rate that Bestmed negotiated with the doctors at 100% is what would be paid. If a doctor charges more than 100%, in other words 150 or 200 or 300%, this can be because they are longer in the industry or they are better or it's a specialized procedure. The rates that they charge above 100% would be for your own pocket. Again, reach out for a gap cover because you can claim those rates back from a gap cover. You do have some take-home medicine. Important, this has to be issued from the hospital's pharmacy. It's not the pharmacy at the hospital. It must come from the hospital dispensary directly. Biological medicines is very expensive medicine that's used for very specific procedures or conditions, and they did include a small amount of 10,000 Rand from next year. Mental health is covered in full as per the guidelines that's set out by the Council for Medical Schemes, and then everything else is at 100%. These are your in-hospital benefits. You'll see with the organ transplants, they mention PMBs only. That would be in a life-threatening situation or something like that. Very, very, very important if you're considering Bestmed's Beat 1 option is that all the major maxillofacial surgery is only covered as PMBs. And a big portion of this is when you extract your wisdom teeth. If it's not a PMB, they will not cover it. So essentially, wisdom teeth extractions would be included from this. So if you pick this option, either make sure that your wisdom teeth don't give you any problems or they should be taken out already. You'll see here dental and oral surgery in and out of hospital comes down to the same thing. It's only covered at PMB level. This option doesn't provide any benefits for prosthesis. I'm saying it doesn't provide any benefits. That's wrong. It doesn't provide benefits for major joint replacements. So you do have a prosthesis limit of 82,000 Rand for a family, and it's divided into these subcategories that you can read here below. So they do pay for functional prosthesis and pacemakers and all of those things, but no benefit or PMB only for external procedures. And then you'll see here, this is what I referred to earlier, exclusions and limits is on joint replacement surgery. So this would be in the case where you need a new knee or a new hip or something like that. They won't pay for that unless it's a PMB. If you are young and you've got no previous injuries, a PMB would be something like where you're in a vehicle accident and you injured your hip or your knee so badly that the only treatment available for you would be a total joint replacement, and then they will only pay for the prosthesis up to these set out limits. Radiology and pathology is covered in full up to 100% on the medical scheme. Cancer is also covered at 100%. They do make use of a designated service provider. That's this DSP that they mention here. And then also remember with oncology, should you be diagnosed with cancer, Bestmed is one of the few schemes where they allow you to upgrade to any option within Bestmed if your medical scheme doesn't cover the full, or if Bestmed doesn't cover the full treatment plan that your oncologist gives out to you. So that's a very, very, very good benefit. Obviously, your premium will increase, but so will the cover that you receive. Dialysis is also at a designated service provider. Birthing is covered in full, as well as HIV and AIDS. Refractive surgery is for PMBs only. And then you'll see the rest of these things that they mention is stuff that pertains to your hospital care, and then palliative care that they increased the limit to 60,000 Rand from next year. This option also provides international travel cover. It's always important to make sure you understand how this works should you be traveling abroad. You can just reach out to us or to Bestmed and then just get the brochure or the pamphlet or the rules that go hand in hand with it. The out-of-hospital benefits are very limited on this because it's mainly a hospital plan. So what you have is you've got diabetes primary care consultation, so that's a very nice benefit. Wound care, that would be after surgery or a serious wound that you got. You also have your MRI and CT scans that's paid up to 5,567 Rand. Important to note here that won't be enough to get a full scan. You will be able to get a full scan in hospital. If it's out of hospital, you're not admitted, you can claim that 5,567 Rand, and then the rest will be claimable from a gap cover if your gap cover provides the benefit. So once again, important, reach out to us, make sure that you're covered and that gap is covered. This option does provide chronic medicine. So your normal 26 conditions is what we refer to as CDL and PMB chronic medicine, and that is covered in full. And if you use the formulary medicine, then you shouldn't have any co-payments. If you don't, then a 30% co-payment will apply. Important here that sometimes the pharmacies can add what they call a dispensing fee. So even if it says there's no co-payments, you might be liable to pay a dispensing fee or a price difference or something like that at a pharmacy. There's no non-CDL medication. The biological and other high-cost medicine is PMBs only and as funding protocols. Acute medicine is what the doctor prescribes. There's no benefit for over-the-counter medicine. You can again pause the video here to see the conditions that are covered under the chronic section of this plan. If I can highlight a few that's very popular or more common, it's things like asthma, bipolar, we've got diabetes here, we have epilepsy here, high cholesterol, high blood pressure, hypothyroidism is if there's problems with your thyroid, and those are probably the things that are claimed on the most. Bestmed very uniquely provides additional benefits for all of these conditions. Fantastic that they put it in the brochure and claim up front that you can get that. Bestmed also has a wonderful preventative care range, so you can get your flu vaccines, pneumonia vaccines if you're under 2 years old or if you fall in a high risk group. There's baby growth development assessments that you can have 3 per year at a network pharmacy. And then Bestmed also pays for female contraceptives, and this is 2,412 Rand per year. And then they pay for different types of contraceptives. So it can be tablets, or it can be UIDs once every 5 years, like mentioned there. They also do for the ladies, they do HPV vaccinations. Mammograms is a new benefit. If you're older than 40, you can go once every 2 years. And then if you are struggling with your back and you need to go for back operation, you can apply for the back and neck preventative program. And there they assist you with several things to try and reduce the risk for an operation. And then the ladies also have a pap smear once every 2 years if you are older than the age of 18. You can pause here and read a little bit about the Tempo Wellness Program and what it is that you can do and what it is that you can qualify for with this benefit that they've added. And so that's very nice. And then also there's a small maternity benefit that's definitely helpful. You get 6 antenatal consultations, 1 lactation consultations, 2 2D sonars that you can claim for if you are pregnant. Very nice with Bestmed. They've got a nice maternity program that you register for. They send you a couple of gifts and a welcoming pack, and there's also 24-hour medical advice line. That's very helpful, especially if it's your first baby. So here's all the contact details for Bestmed. Please reach out to them, reach out to us. If there's anything we can help you with, feel free to contact us at Key Wealth. Thank you.